Plantar fasciitis is an inflammation of the plantar fascia. And the plantar fascia attaches the heel bone to the base of the toes. It tightens as you walk. And that adds, as you can see here, and that adds support and stability to your foot. The most common symptom of plantar fasciitis is pain on the inside of the heel. And that heel pain is usually worse upon the first couple steps, getting out of bed in the morning, then tends to ease up, and then increases again after increased walking. And if these symptoms go untreated, they can eventually result in knee, hip, and back problems. Runners are very susceptible, probably because of the increased stress that running places on the plantar fascia. We also see it in patients who are overweight, have high or low arches, or have tight calf muscles. Physical therapists play a vital role in the treatment of plantar fasciitis, and we can provide multiple treatment options. Iontophoresis is the delivery of an anti-inflammatory medication that we apply to a patch, and then we use this unit to deliver an electrical current, which will then drive the medication into the target area, which is the insertion of the plantar fascia. And the patient usually sits with that on for about 15 minutes, and we'll do 4 to 6 treatments to get the full effectiveness. Physical therapists can also use a device called a cold laser, and that helps decrease pain and the symptoms of plantar fasciitis via delivering light waves that increase the cellular activity at the site. Physical therapists can also apply tape, instruct you in strengthening exercises and stretching exercises. The first one is going to stretch the calf muscles. In this position, with the heel on the floor and maintaining as much of an arch as possible, the patient's going to lean forward, pushing the hips forward until they feel a nice stretch in the calf. Then, to stretch the heel cords, the patient's going to come back, lean back a little bit, bend the knee, keeping the heel down, maintaining that arch until they feel a nice stretch in the heel cords, okay, which again attaches the calf to the heel. Lastly, we're going to go back to a straight knee and put a towel under the toes, okay, since the part of the plantar fascia attaches to the base of the toe. It actually crosses the toe joint. So if we put that there and again lean into it, that's going to get a little bit more of a stretch to the plantar fascia and to the calves. A physical therapist can also help identify any faulty movement patterns that may be contributing to your condition. And how we would do that would be we would assess or observe you performing certain functional tasks. And then from there, instruct you in exercises that can help correct those faulty patterns. And ultimately, may prevent you from needing surgery down the road. A physical therapist can also help by using manual therapy, which is where we use our hands to increase mobility. As you can see, we're tight here. So if we want to get more motion, I can press my thumbs right into the joint there, and I apply a downward and inward pressure as I perform the motion that is limited. And this is to get increased mobility in this motion, which is called dorsiflexion. Another manual therapy technique is to increase the extensibility of tight calf muscles. And in order to do that, I'm going to use an active release technique. I'm applying my thumbs to the tightest part of the muscle, and I'm applying an upward and downward force as the patient flexes into the motion that is limited, and then releases, and then we do that again, applying that upward downward force, not too hard, and release, and we do that 10 times. At that point, we should see an increase in flexibility and motion. A good thing to remember about plantar fasciitis is that 90% of patients will get better anywhere from 2 months to a year.